Bismillahirrahmanirrahim. Assalamu alaikum students. Today we will be discussing an important topic of CVS, that is ability of heart performance, or how can we assess the performance of a patient's heart. We can also call it cardiac performance. Students, first of all, cardiac performance depends upon these four factors. What are those factors? Number one, preload. Preload, it is the load or work imposed on the heart before the start of contraction. It is, we can say that it is an homework assigned to the heart before the start of classroom. Preload is the load imposed on the heart before the contraction begins. It is usually end diastolic pressure when the ventricles has been filled. Students, preload depends upon two factors: venous return to the heart and stretch of the cardiac muscle fibers. More venous return to the heart, more will be the preload. More work will be available for the heart. And stretch of cardiac muscle fibers is more, it will lead to more stronger preload. Students, there arise Frank-Starling law of cardiac muscles. In very simple words, according to Frank-Starling law of cardiac mechanism, greater stretch on the ventricular muscle fibers leads to increased force of contraction of the ventricles. I repeat, more contraction of muscle fibers of cardiac muscles will lead to more stronger contractile motion of the heart. This is Frank-Starling law. Students, the actin and myosin filaments of the cardiac muscles, they overlap with each other at a maximum stretch, or we can say when the ventricle muscles are overstretched, there remains an area of overlapping between these actin and myosin filaments. It is because of this area of overlap that when we have stretched the ventricular muscle fibers, they will contract with a more stronger force. This is Frank-Starling law. Students, second factor is afterload. Afterload means pressure with which the muscle exerts its contractile force in order to move blood into the aorta. Or we can say in very simple words that afterload is the pressure with which the blood is forced into the aorta. It depends upon systemic arterial blood pressure, which is afterload on the left heart, pulmonary arterial pressure, which is afterload on the right heart. Now students, what is cardiac contractility? It is the ability of the cardiac muscles to change their force of contraction without changing their resting length. Ability of the heart to change its force of contraction without changing its resting length. cardiac contractility allows the heart to continue its pumping action according to the venous rhythm. Now, heart rate, it is the frequency with which the blood is ejected into the aorta. Heart rate is the frequency with which the blood is ejected. So this was all about ability of the heart or the factors which influence the cardiac performance. Please take a brief look.
वालेकुम अस्सलाम, क्या हाल है जनाब? ठीक हो आप?
Thank you, students.